Okay.
Let's call the Health Committee meeting to order. September 1st, 2015, 9:32 a.m. First item of business is public comments. Are there any public comments? I believe we have one. Next item of business, agency reports. I believe we have one reporting today, Mr. Thompson. Good morning.
Good morning. Not a lot to report. We had our last day scheduled for a week ago, and it had to be rescheduled because of absences, and I wasn't able to be there, so we didn't take up directly the matter of the budget. However, as I was just saying to Dave here, our requests have been very, very, steady over the last 10 years or so. So I don't anticipate that there will be any change to speak of. In fact, I think probably be requesting the same amount we did last year, and so if I took, unless something comes up, I don't see anything. So far this year, we have distributed 50% of the amount that was budgeted. That because we got the first tax payment, and so we're halfway there on our budget. And Anita said she's going to give me something in writing to fill out, so I'll fill that out. And put that in. Last year, our cap would have been 0.15. The request that we had and that you approved resulted in a 0.123 extension. So we were under the cap, which always surprises me since I do a few taxing districts, and it seems as if everybody was capped there for a long time. But that was good news. Any questions?
Question? No?
Dale said that the assessor expected that the EV may go up, which is a shock to me, but whatever. We think the best idea for the board and for the county is to adopt a very steady approach at funding, so that I know that there were these wind machines that came in a few years ago, and a lot of districts, well, we want to get as much as we can. We're going to go truth in taxation and pick up a windfall in a way. And we didn't do that. We did not want to get to a position where the center was counting on a large amount of money, and all of a sudden it was not going to be there, because we had figured that those are going to decrease and disappear over time, and I think that's actually part of the program thing. So that's the way we feel about it. We're going to just try to be steady about it so that they know that this is about what they're going to have to deal with, and we don't have a lot of slack anyway. There isn't much more that can be gotten under the cap. There's a little bit, but as I was mentioning to Dale, over the years we have been lessening in the amount percentage-wise that we provide of their budget. They have altered their funding sources. They've gone to a fee-for-service model, which requires them to make some alterations in their charging and their invoicing and who they go to, and the result has been a little more income for them, and as a result we have become a small part of the pie. But we're a steady part of the pie, which I think is important for organizations these days. So that's all of that.
Thank you. Seeing no other agencies, D, your report, please.
Yes, our Board of Health met last Wednesday night. As far as the tax levy goes, the board approved a level funding for the tax levy. No increase or no decrease. We has last year gone from 480 the previous year to 400,000, and that's what we would like to remain at. The state of Illinois, Illinois Department of Public Health, and the Illinois Association of Public Health is encouraging public health departments to increase their reserve. Their prediction is that with an unsigned state budget this year, that we'll be facing the same thing next year with the same Democratic legislature and Republican governor having a different, of opinion about the budget. So they're encouraging us to reserve as much money as we possibly can. And we did discuss that at the Board of Health meeting, but I'm very comfortable with level funding and not increasing the tax load. So their vote was to level fund it. As far as the state budget goes, we are now getting, because of the legislature, we're now getting federal pass-through money. So a lot of our programs, for example, WIC is like 85% federal and 15% state. So we're getting federal money in now, or will be very shortly. The state is also encouraging us to go ahead and send in our EDS, our expenditure documentation forms. We send those in anywhere from the 10th to the 15th of every month for the previous month's services, and they're encouraging us to get those in even if they're a state-funded grant, so that they're sitting in queue, and when the budget's signed, they can be paid out right away. We are still subcontracting to IMH under the Public Health Services Agreement addendum. We will have it's an extension of last year's agreement with a smaller funding amount until the state budget is passed and we receive final allocation amount from the state for those three specific programs. We have sent in the Department of Human Services spending plans and GSA budget, even without, we were encouraged to go ahead and submit those preliminarily, even without a state budget signed, so we did that. But those amounts, as you know, can change. We had a lot of flood activity going on over the last couple months. We were at the shelter doing TB assessments and TB skin testing and making sure people were transported for bathing and so forth. As far as the food sanitation, the restaurants and low-risk establishments have all been opened back up. Wells and water samples, we did a lot of free water sampling to the state lab. We still are having some issues with a couple wells, but Terry is working on that with the well owners. We're still providing a lot of information about mold mitigation for people who have the potential to have a mold issue in their home. West Nile virus surveillance is still ongoing. Terry was able to secure additional larvicide for different communities so that right after the flood, we have that applied to help reduce the risk of West Nile virus from standing water. We are participating with the Iroquois County Long-Term Recovery Committee, and we want to work diligently with the seniors through the Senior Services Program to help them with the needs that they may have. In the handout that I gave you, the summary report, you can see that our temporary food permits went up. They always go up over the summer for the fair and the temporary food visitors. The water increased doubled from most months. That was due to the flooding. Obviously, immunizations go up in the summer because kids are getting ready for school. Those numbers pretty much speak for themselves. So if you have any questions on our summary report, just let me know, and I'll answer those as best as I can. Our plan for the following year. I didn't give you an updated grant report because we don't have final dollar amount, final allocation amount on a lot of those, but the state let the local health departments go ahead and sign contracts for all the grants based on the funding that they assume that we're going to get. So those contracts are all those grants have been written, all the contracts are submitted, they're signed. Some of them have been signed by the state health department director and returned back to us. Most of them have actually. But we're waiting on final allocation amounts. But I can tell you that many health departments have a lot of grants that are being cut throughout the state. However, the Iroquois County Public Health Department has the grants that we maintain through our health department appear to be what's considered priority for the state. We don't have a lot of the extra things. So our grants should be pretty stable. We don't do a lot of the above and beyond grants. That tend to be a one-year grant and you don't get it, and then a couple of years later you can apply for it again, that type of thing. We have been assisting Champaign Public Health Department through the IPMS, which is the Illinois Public Health Mutual Aid System. They've sent out several requests asking for nurses to help with the immunization clinic that they have at the University of Illinois for the mumps outbreaks that they're experiencing. Officially, they have over 100 laboratory confirmed cases of mumps associated with the University of Illinois students or staff. So they're encouraging all students and staff to receive a booster, a mumps booster. I sent nurses on all 4 days, I sent nurses on 3 out of 4 of the days that they had clinics, and one day I sent someone to be a winner. They have been very grateful for that help. I've received numerous thank yous for our assistance. Now, when we assist another public health department through the IPMS requested state request system, that assistance that we give them is at our cost. But we definitely need to do that because if we're in the opposite situation and we need help and additional nursing staff, I know that they would help us. The budget that I submitted to the Board of Health last Wednesday night was approved unanimously by the Board of Health. I'll be presenting that budget to the Finance Committee on Thursday. But if any of you would like to take a look at it, you can see one, and that's fine with me as well. Any questions?
No questions? Thank you, Dean.
Thank you.
Next item of business, claims. You had a chance to read through the claims on the handout. I would entertain a motion to approve. So moved. Second. It's been moved and seconded. Any questions on the claims? Observations?
Schultz,
Yes.
Schmid,
Yes.
Whitlow,
Yes.
Persley,
Yes.
Crumwitty.
Yes. Motion carries. Next item of business, old business. Next item, new business. If there's nothing else to come before this board, I would entertain a motion to adjourn. So moved. It's been moved. Second. Seconded by Dan. All in favor, aye?
Aye.
Opposed, same sign.